Assalamualaikum and good day everyone. In this presentation, our group will discuss the COVID-19 pandemic as a case study in crisis management in the tourism industry. First, HAFIZ will present the introduction and risk assessment. Next, IZZATI will explain the crisis management system. Then, IRDYNA will present the crisis communication plan and the crisis communication tools. After that, NABIL will discuss the crisis management team and communication team. This will be followed by ZULAIKHA, who will present the recovery strategy. And finally, Adam will conclude with evaluation and monitoring, as well as the conclusion and recommendation. So, without further ado, let's begin with the introduction. The COVID-19 pandemic is a global health crisis caused by a virus known as SARS-CoV-2. It was first detected in Wuhan, China in November 2019 and spreads easily through coughing, sneezing, and contact with contaminated surfaces. Because of its fast transmission, the World Health Organization declared COVID-19 as a global pandemic. This pandemic not only affected public health but also severely impacted the global economy, especially the tourism industry. Government introduced lockdowns, travel bans, border closures, and social distancing. As a result, flights were cancelled, borders were closed, and tourist arrivals dropped sharply. Now, I will explain the main types of risks involved. The first risk is health risk, which refers to the fear of getting infected and becoming seriously ill. This was the main reason many tourists cancelled or delayed their trips. The second risk is psychological risk, such as stress, fear, and uncertainty. Many people were worried about their safety and the future, which reduced their willingness to travel. Next is financial risk. Many tourists lost money due to cancelled trips, while tourism businesses face serious revenue losses and even closures. This caused unemployment and weakened local economies. Operational risk also increased. Tourism businesses had to change their operations by introducing contactless services, online bookings, and strict hygiene procedures to ensure safety. Finally, reputationally risk-affected destinations with high infection rates or poor safety management, making it harder to rebuild tourist confidence. In conclusion, the COVID-19 pandemic created multiple risks that strongly affected tourist behavior and tourism performance. However, it also encouraged better crisis management, digital transformation, and stronger safety practices. Learning from this experience is important to build more resilient and sustainable tourism in the future.
Now we explain how the crisis management system using the 4R framework was applied during the COVID-19 crisis, especially in the tourism and hospitality industry. So first, I will start with the reduction, also known as the risk mitigation. So reduction focuses on the action taken before a crisis to reduce possible risks. During COVID-19, this mainly involved health and safety measures. Tourism businesses increase cleaning, enforce mask wearing, improve ventilations, and manage crowd numbers. So governments also introduced travel controls and health screening at the borders. This action helped reduce the spread of virus and limit the negative impact on tourism activities. The second stage is readiness or preparedness. Readiness refers to how prepared organizations are to handle a crisis when it happens. So during the pandemic, tourism organizations developed COVID-19 response plans and trained staff on the health protocols. Clear communication systems were set up to share updates with employees and tourists. So government worked closely with the health authorities and tourism bodies to provide guidelines. So this level of preparation helped reduce confusions and allow faster decision making. Third stage is response, which takes place during the crisis. So during COVID-19, response measures included border closure, lockdown, flight cancellation, and temporary closure of the tourism facilities. So tourism businesses focus on protecting guests and staff while maintaining trust. So clear communication, flexible booking policies, and refund options were introduced. So these actions were necessary to protect public health and manage the crisis effectively. The final stage is recovery, which happens after the crisis. So recovery focuses on the restoring tourism activities and improving resilience. After COVID-19, destinations reopened gradually with safety guidelines, health certificates, and safe travel campaigns. Government provided financial support to tourism businesses. The industry also reviewed its crisis response to improve future planning and also sustainability. So we can conclude that 4R framework helped the tourism industry manage the COVID-19 crisis in the structured way by reducing risk, preparing in advance, responding effectively, and supporting recovery.
Next, I will be explaining about crisis communication plan. During COVID-19 pandemic, the Malaysian government focused on clear, consistent and factual communication. Firstly, the Ministry of Health published guidelines to educate the public on preventive steps such as wearing masks, wash hands, keeping physical distance and staying at home during the movement control order. In addition, daily press briefings provided updates on new cases, death and high-risk areas which help people understand the seriousness of the situation. Later, when the vaccination began, messaging shifted to the vaccine safety and effectiveness to encourage public participation. For example, there was a campaign Pembudayaan Norma Baharu with the tagline Bersama Hentikan Wabak COVID-19, which was promoted across TV, social media and posters to remind everyone their shared responsibility in stopping the spread of COVID-19. For the communication channel, Malaysia used multiple communication channels to reach the public. Firstly, digital and mobile platforms were widely used. The MySejahtera app allowed QR code scanning, health update, vaccination registration and also exposure notification, while official websites and SMS alerts share guidelines and reminders. Next, traditional media like TV, newspapers and radio also help reach people who were less active online. TV and newspaper broadcast press conference and updates, while radio remind listeners to wear masks, wash hands and avoid crowds. Finally, social media and messaging apps allow both authorities and the public to share information. MOH used Facebook, Instagram and YouTube, while the public share info via WhatsApp, Twitter and Instagram. Altogether, this channel ensure information reach everyone quickly and effectively. Next, for the stakeholders' involvement, there are several stakeholders that play important role in managing the crisis. First, the government, especially the Ministry of Health and the National Security Council, led the overall response. They managed testing, treatment, contact tracing and enforced safety measures like the movement control orders. A major tool they used was the MySejahtera app, which helped track cases, monitor quarantine and manage vaccination registrations. Second, the NGOs and civil society groups supported vulnerable communities. Organizations like IMARID mobilized volunteers, distribute personal protective equipment and also provide aid to low-income families and refugees. They also help educate the public about COVID-19 safety and encourage vaccinations. Finally, communities and volunteers played a crucial role at the local level. Volunteers helped at vaccination centers, guided residents and supported community initiatives to ensure compliance with health measures. Programs like MyVac made it easier for elderly, residents and vulnerable groups to get vaccinated. Together, these stakeholders work as a team to reduce the impact of the pandemic and keep Malaysia safe.
Our focus is on the crisis management team and the crisis communications teams in the context of tourism crisis management in Malaysia during the COVID-19 pandemic. During a large-scale crisis like COVID-19, tourism organizations cannot operate effectively without a clear leadership and communication structure. Therefore, the crisis management team, also known as the CMT, and the crisis communication teams or CCT, play a critical role in coordinating response, actions, decision-making and information flow between the government, tourism industry and the public. Moving on to the next part, which explains the team structure. The crisis management team is a formal leadership group that is activated when a crisis occurs. In Malaysian tourism context, the CMT must align with national crisis governance involving agencies such as the Ministry of Tourism, Arts and Culture, the Ministry of Health and the National Disaster Management Agency. During the COVID-19 pandemic, Malaysian tourism organizations depended heavily on the structured crisis teams to adapt to changing the SOPs, manage operational disruptions, and communicate clearly with the tourists and stakeholders. This showed that a well-defined team structure is essential to ensure coordinations, accountability, and fast decision-making during a crisis. The CMT structure usually consists of senior leaders from different operational areas, such as one is operation, communications, health, finance, legal, and information systems. This multidisciplinary structure allows the organizations to respond to different types of risks at the same time. Next, I will continue the purposes of the crisis management team. The main purposes of the CMT is to provide a strategic leadership during a crisis. The team is responsible for making key decisions, coordinating response actions, and ensuring that all departments work together under a unified strategy. Another important role of the CMT is to reduce uncertainty. During a COVID-19, tourism organizations face frequent changes in the travel restrictions, lockdowns, and health requirements. The CMT help reduce confusion by ensuring clear responsibilities, consistent communications, and continuity of essential tourism services. In addition, the CMT acts as a link between the organization and external stakeholders such as government, authorities, industry partners, and the community. These coordinations help Malaysian tourism organizations adapt more effectively and build operational resilience throughout the pandemic. Now we move on to explain the typical crisis management team hierarchy. As shown in the organizational chart on the screen, the crisis management team in Malaysian tourism organization follows a clear hierarchical structure to ensure effective coordination during a crisis. At the top of the structure is the crisis management leader, who holds overall authority and is responsible for activating the crisis management plan and making the final decisions. By reporting directly to the leader, there are several key functional roles. These include the operations lead, who manage operational continuity and ensure compliance with standard operating procedures, and the communication lead, who coordinates the internal and external messaging together with the crisis communication team. The structure also includes a public health license, who ensures that all actions follow guidelines issued by Ministry of Health. In addition, the Human Resources Coordinator manages staff welfare and internal communication, while the Finance and Risk Officer oversees financial impacts and crisis budgeting. To support governance and operational stability, the team also includes a legal and compliance advisor as well as IT information system support, which maintains a digital platform needed for crisis coordination. This organizational chart shows that the crisis management team is multidisciplinary, allowing Malaysian tourism organization to respond more effectively and build operational resilience during the COVID-19 pandemic.
Next, I will continue to explain about crisis communication tool and manuals. During a health crisis, timely and clear communication is crucial to keep the public informed, calm, and also confident. One of the main tools used is a holding statement, which allow authorities to acknowledge a situation early, provide verified information, and reassure the public even before all the details are available. During the COVID-19 pandemic, the Ministry of Health issued its first official holding statement on 13 February 2020. This statement clarified reports of a COVID-19 death in Pulau Pinang, which was later confirmed negative. A few weeks later, on 2 March 2020, the MOH released another update reporting 29 confirmed cases and emphasizing ongoing monitoring and containment efforts. These early communication were essential in preventing misinformation, maintaining public confidence, and also demonstrating how holding statements can effectively manage public perception during emerging crises. After the initial holding statements, the Malaysian government used press release and media statements to provide detailed updates on COVID-19. These tools help explain government actions, guide public behavior, and maintain transparency. For example, on March 16, 2020, the Prime Minister announced the movement control order via a press release, informing the public about the seriousness of the situation and the instruction to follow. The next day, the Ministry of Health issued a press release titled Situasi Semasa Jangkitan Penyakit COVID-19 di Malaysia, sharing updates on confirmed cases, recoveries, death, clusters, and also health measures like quarantine, testing, and contact tracing. These updates were delivered by the Director General of Health and shared widely through television, online news portal, and social media. Overall, press release and media statement build trust, reduce misinformation, and ensure citizens had accurate information throughout the pandemic.
For the marketing initiative to support recovery after COVID-19, businesses should focus on digital marketing that highlights safety, flexibility, and value. This includes promoting contactless services, flexible booking or cancellation policies, and attractive promotions. Social media and influencer marketing can help rebuild trust by sharing positive experiences and showing that safety measures are in place. According to United Nations World Tourism Organization 2021, focusing on domestic and nearby market can speed up recovery as people prefer local travel before international travel. Next is action to restore confidence and reassure stakeholders. To restore confidence, businesses must communicate clearly about their health and safety measures. Information on cleaning procedure, vaccination policies, and standard operating procedures should be shared through website and advertisement. Collaborating with health authorities and obtaining safety certification can further build trust. Training employees and supporting their well-being also ensure good service quality. This action reassure customer and stakeholder that the business is committed to safety and long-term sustainability.
Evaluation and monitoring focuses on checking whether the crisis management actions are effective and still relevant. After COVID-19 hits, tourism organizations need to review what worked and what did not work. This includes monitoring tourist arrivals, businesses recovery, health data, and also public confidence. Feedback from tourists, employees, and also stakeholders is also important to understand real impacts on safety and service quality. Continuous monitoring helps destination detect early warning signs of new risks, such as health threats or negative media coverage. Through regular evaluation and monitoring, tourism destinations can improve their crisis plans, respond faster in the future, and ensure long-term resilience and sustainability. This report shows that COVID-19 had a major impact on the tourism industry, especially on safety, travel demand, and destination image. This crisis proved that tourism destinations must be prepared and cannot rely solely on reactive actions only. Effective crisis management, clear communication, and strong coordination among stakeholders are very important and crucial to reduce impacts and speed up recovery. Based on this study, it is recommended that tourism organizations strengthen structured risk management, improve crisis communication strategies, and also continuously monitor potential risks. Regular training, use of data, and early warning system should also be enhanced. By doing this, tourism destinations can become more resilient and protect their reputation, and last but not least, recover faster from future crises.